Good evening. Thank you very much for joining us here on Mirror Now. I'm Heena Gambhir. On Urban Debate at 8 p.m. tonight, we will try to find out if it's time for Delhi to ease COVID curbs. With the plateauing of the third wave in Mumbai, the government of Maharashtra has decided to reopen schools for all classes from 24th of January. The Health Minister of Delhi, Satyendra Jain, today said that it seems the peak of third wave is behind us, even as he cautioned that the national capital is not out of the danger zone yet. He believed that the result that we have got is an outcome, in fact, of the measures that were taken, that too on time. Now, across the country, there has been a jump with daily COVID count crossing the 3 lakh mark today, as states like Karnataka and Kerala are seeing a surge in daily COVID cases. But Delhi seems to be witnessing a declining trend. While across the country, after a very long time, we have seen the daily COVID count crossing 3 lakh mark. In Delhi, from 24,000 cases that we saw on 14th of January, the daily COVID count has come down to about 12,306 cases today. The graph has seen a steady decline. Even the positivity rate seems to be sliding. It has come down to 21.48% today, and that is another encouraging indicator that tells us how the situation in the national capital is. But viewers, these graphs that we are now going to show you are most important graphs. These graphs show a comparison between the second wave and the third wave. The bed occupancy this time has been much lower. Even at the peak of third wave, we have seen the bed occupancy rate, or the hospitalization rate rather, being much lower than what it was during the second wave that we saw last year. This is a comparison, in fact, that was shared by the Ministry of Health today. The line that you see at the bottom of the graph, that shows the hospitalization rate, and the line above shows you the positivity rate. So you just see that how this time in the third wave, the situation in terms of hospitalization rate was much better as well. This graph, in fact, indicates what was the scenario in the third wave. Hence, there is a bit of confidence. As a result, industry body FICCI has urged Delhi government to ease curbs to minimize economic losses. Before we begin this debate, let's go across to Arun Chawla, Director General FICCI, to understand why he feels it is in fact the right time to lift some curbs from the national capital. Mr. Chawla, thank you very much for joining us here on Urban Debate on Mirror Now this evening. Now, we know that FICCI has urged Delhi government to ease curbs to minimize losses. What exactly are you demanding, and why you think this is the right time?
So let me give you the background to our matter. It's absolutely well known that Omicron is a highly transmissible, but emerging evidence suggests that it is mild and does not require intervention in most cases. Hospitalization is, of course, significantly lower than the previous wave. And in Delhi particularly, it has been observed where the peak of COVID cases has been reached. There's been a steady downslide of cases, which is being observed now. On Wednesday, 19th January, it was reported 13,785 new COVID-19 cases, as against a peak of 28,000 cases. And also the hospital occupancy has not yet saturated. So large portion, almost 85% of COVID-19 beds are lying vacant. And this has been admitted by the Honorable Minister of Delhi, Health Minister himself, that the peak of the third wave of COVID-19 seems to have gone past in the national capital. Of course, we need to watch the trend, but so far that is the case. So, coming to the fact that we have to both lives and livelihoods both are important, and we have to take a very rational approach. FICCI's COVID task force, comprising of experts from the healthcare and related sectors, actually deliberated on the economic activities matrix, which proposes of 4 risk levels based on the level of hospital beds occupancy, with an additional factor of total cases vis-a-vis the second wave. Now, it was deliberated that since Omicron is highly transmissible but less severe, positivity rate will not be the right criteria. Instead, the restrictions must be based on hospital bed occupancy. And as per this matrix, if COVID bed occupancy is between 20% to 40% for 1 week, there is low risk and the economic and mobility restrictions should ease. So it was in this context that we wrote the letter to the Honorable Minister, urging him to sort of reconsider the restrictions announced by the DDMA. And as far as the economic losses are concerned, that is, of course, I have a lot of data and facts which shows that, economic losses are being incurred. So we have to actually take a very rational approach and balance out both the lives and livelihoods.
Mr. Chawla, could you also tell us a little bit about the impact that these restrictions really had on industry?
I'll tell you, the Sadar Bazaar traders, this is something which is a fact. They held a protest against odd even rule this week. And the traders have not been able to cope with the 2 lockdowns already. And this decision was breaking their backs, as they said it. And as of December itself, shops and malls were reporting a 10 to 15% fall in sales across many cities. But Delhi, particularly, where there was a weekend curfew and odd even opening of shops, malls are expecting a 50% drop in sales. Weddings, social functions, even large budget events are being postponed. I mean, putting a total damper on the hospitality industry's recovery. And, according to CIT, this is the Confederation of All India Traders, wedding trade is now likely to be reduced to a mere 1.5 lakh crore from an earlier expected revenue of about 4 lakh crore. Let me give you some all India figures as well. As per the survey of the Retailers Association of India, beauty, wellness, and personal care declined by 7%. Furniture and furnishings fell by 5%. Other segments like sports goods reduced by 14%. Jewelry 9%. Footwear was 7% lesser. Apparel and clothing, well, the growth was only 2%. All experienced a drop in sales according to the Retailers Association of India. So, keeping all this in mind, what we urged the Delhi government was that instead of looking at only the positivity rate, they should look at the occupancy of the hospital beds and ease the restrictions based on the numbers occupied in the beds occupied in the hospital. So that was it.
Now, Mr. Chawla, you're saying that, one should be looking at the occupancy rate, the hospitalization rate in a scenario like this. But, can it not be also because of people staying indoors, because of the restrictions that this hospitalization rate has been much lower and situation is under control? So, and you yourself have acknowledged that, it is highly transmissible. So if suddenly restrictions are lifted, won't then that become a problem because it's still not over yet, the third wave?
Let me tell you, as per several doctors, the infection is not causing severe symptoms and deaths as witnessed during the second wave. Most people are recovering on their own in home isolation. So obviously, since there is no rush for hospitalizations, and while Omicron is highly transmissible, but it's less severe, so positivity rate will not be the right criteria. Instead, the restrictions must be based on the hospital bed occupancy.
And Mr. Chawla, could you also help us understand which economic activities should now be allowed properly? Where do you think the restrictions should be lifted completely?
I think there's certain restrictions are placed in a certain order. And as the Honorable Minister today said himself, that we will now look at revoking those restrictions in the reverse side. So I think immediately they should now start looking at people who are, at least for the fully vaccinated, the economic activity can be restarted, and the private offices are closed. I think they should again come back to the roster system, and as we watch the trend, we should then open up with certain safeguards of the COVID appropriate behavior. I think that's how we should proceed.
Okay, and last question before we let you go, Mr. Chawla. If, the curbs or restrictions are not lifted immediately because the danger is still very much here, and if, for 2-3 weeks these restrictions continue, can you tell us a little bit about the impact that it could have on the industry, how difficult it will be?
I think it will not only impact the industry, it will impact livelihood, as I said. And then it's a vicious circle. So I think looking at the trend, we should now not be that restricted. That's what I feel.
All right, Mr. Chawla, appreciate you joining us here on Urban Debate on Mirror Now. Thank you very much for speaking with us. So let's try and get an answer to this very important question. Is it time to lift the restrictions that were announced by the Delhi government after we saw the third wave beginning in the national capital, with the case count coming down, with the positivity rate coming down, with the hospitalization rate also being much lower as compared to what we saw during the second wave? Joining us on the broadcast right now is Heena Gupta, spokesperson of Aam Aadmi Party. We have Hemant Kochar, Chair, Uttarakhand Chapter, PhD, Chamber of Commerce and Hotelier, Joint Managing Director, Hotel Madhuban. Dr. Soumitra Rawat, Member, National COVID Task Force, joining us on the broadcast. Also, we have this evening with us Praveen Khandelwal, Secretary General, Confederation of All India Traders. And viewers, it's a platform for you as well. The numbers will be flashing at the bottom of your screens. You can also call us and share with us your concerns, or if you have any questions about whether it is time really to open or lift the restrictions that are there because of the third wave in Delhi. Heena Gupta, let me begin the discussion with you. You just heard, the FICCI DG, Director General, Mr. Arun Chawla, who has urged the Delhi government as well to lift the restrictions, to ease the curb slightly because it's having an impact on the livelihood of the people. How soon can we expect things to move in this direction with the case count coming down?
Heena, we've seen with this virus that it has been a highly unpredictable virus. This time around, of course, the rate of hospitalization is low, which is very good. And also Delhi, because of, all thanks to all the COVID warriors, Delhi has one of the best vaccination rates in the country. All the adults in Delhi have received their first dose and 90% have received their second dose as well. And it's only because of all of this, and the people of Delhi have also, I have to, acknowledge that the people of Delhi have also been very disciplined. The COVID appropriate behavior of wearing a mask and all, has been practiced to a large extent in Delhi. So we have seen that this time around, the hospitalization rate is much lower. Because of that, only the government is now thinking of seeing, what all restrictions can be removed. But, we have to remember that only till last week, Delhi was still showing a positivity rate of around 30%. It's only because of all the restrictions and the weekend curfew that the rate has now come down to around 21%. So the government at the highest level, at the Chief Minister level, is watching the situation very carefully. Honorable Chief Minister of Delhi has always said that lockdown is not a solution to this virus. And, we don't believe in lockdowns. And that's the reason why, in Delhi, we still don't have a lockdown, even though, there are certain supporters who've been asking for a lockdown because of the high positivity rate. So the government is monitoring the situation very closely. And as we see the positivity rate, we are hoping in the next 2-3 days, it'll go down even further. So the next week, I'm hoping that we'll see some of these restrictions hopefully will be lifted, and we can, go back to some of our normal lives.
Okay, that's interesting you're telling us. So hopefully next week one can expect some decision in this particular regard. Let's also understand from other guests on the show as to how has been the impact really of these restrictions. Hemant Kochar, can you tell us a little bit about the hotel sector overall? Because, that's the first one, in fact, to get impacted. And then schools are immediately asked to shut down whenever we've seen a spike in COVID cases. Could you just unmute yourself?
Sorry. Thank you so much, Heena, for giving me the opportunity. This industry has been very badly impacted. In the last 2 years, we've seen the worst time of in this industry. I've been in this business for more than 30 years. My father set up this business in 45 years. We in our family have not seen a worse time than this. Where we had to shut down the business for 1.5 years almost. There have been a lot of challenges which this industry has faced because it's a labor-intensive industry. The infrastructure is all solid, so you can't do anything else with it. So it has to be either you do this, you can't do any other business with that. Then the infrastructure which we use inside is something which you can't dilute also. So, hoteliers get stuck with the hotel business because it's a labor-intensive and asset-intensive industry. So, in this long run, I have not seen much help from many corners, whereas hoteliers have been fighters from the very beginning, and we've seen ups and downs in businesses. And hoteliers have come back from the worst times also. But I think this has been the worst hit in the last 2.5 years that we've seen. So it is important that two things which I would like to urge is that one, that people who have loans on them, who've set up these hotels and are presently going through bad times because of loans, they should be somehow incentivized, and they should be given some incentive so that they can easily pay back. Second is people who want to expand and set up new businesses. There are a lot of businesses which are shutting down right now. So this is a time when we should look at incentivizing and helping those businesses which want to set up new things or want to renovate their own businesses and set it up. Because this problem of pandemic is there to be for some time. And, at least the virus, we don't know when this virus will go or what will happen to it. We'll have to live with it. So we'll have to learn to live with it, and the industry will have to change accordingly. And it will become a much safer place. Whereas I still don't understand during the lockdown, why is it that hotels and restaurants were shut in the first place? Because these are the safest places to be. Maximum hygiene, maximum safety, maximum restrictions.
In terms of economic losses, will you be able to quantify for our viewers, Mr. Kochar, for the hospitality sector specifically, what was the impact? I'm talking about the, curbs, the restrictions that came in, especially during the third wave from January onwards.
Yeah, January onwards, I would say that, it was a very tough time. Our occupancies, overall, I'm talking about the whole hotel business, especially in the state of Uttarakhand, where I am. Here we faced a lot of problems that the occupancy rate had fallen down to just about 20-30%. The only business which had shown a bit of revival was the leisure business, but that was limited to the leisure destinations only. The corporate business and other kind of businesses, we didn't get any of the business here. So, and especially conferences, meetings, all kinds of, we call it MICE business, that was missing in action. And still is missing, because a lot of this online thing started off, and we lost a lot of business there also. But this is the time to revive, and for revival, we will need a hand-holding from somewhere, and the government should help us out with that, with incentivizing people who want to renovate and expand. Yeah.
Okay. Okay.
Yeah.
Praveen Khandelwal, your Secretary General, Confederation of All India Traders, could you tell us a little bit about the kind of impact that the curbs that came during the third wave had on small businesses, traders in Delhi specifically?
Well, first of all, I would like to register that the present these precautions taken by Delhi government in terms of odd, even, and simultaneously the lockdown has highly distorted the trade of Delhi. We must understand that Delhi is neither an agricultural state nor an industrial state. Delhi has a centuries-old distributive character of trade and the largest distribution center of the country. So therefore, the major revenue depends upon the businesses. In last 20 days, as per a survey conducted by Confederation of All India Traders, the Delhi traders have lost business to the tune of almost 60%, what they were doing in normal days. So we don't see merit on having both odd and even as also the weekly lockdown. The odd even has a complete failure as far as the trade of Delhi is concerned.
So, one second, Mr. Praveen Khandelwal, I'm just interrupting you there. So, you're saying that 60% business was lost. That was during which period? Could you just specify it for our viewers?
From 1st January to 20th of January, that is today. I'm telling you the
Okay.
latest figures. Delhi is having a annual.
And how many traders? How many traders, shopkeepers were impacted? About whom you're talking about?
Well, the whole spectrum, because Delhi, you can divide Delhi into two segments. One is the wholesale trade, and rest of is the retail trade. Delhi and almost 5 lakh traders from other states of the country usually visit for procuring their requirements. Since last 20 days, not even a single trader outside Delhi has come to purchase even a single rupee. So it has adversely affected the wholesale business. Whereas in case of the retailers, the consumer doesn't want to go again and again. I will give you an example. Suppose if you want to purchase 3 commodities, you want to go for only once to get all those 3. But what you will do? When one commodity is available in odd and rest 2 of the commodities are available in even. So therefore, again you have to go. That means the Delhi government is inviting people to come to streets several times and get infected by COVID. Honorable Chief Minister of Delhi is giving a big lecture here for keeping masks and all that, and we have seen him visiting Punjab and Goa and so many other states where he is laughing and he is not wearing masks. So these kind of,
So, Mr. Khandelwal, I got your point. You're trying to tell us, let's not make it political here because, the idea is to understand the impact this wave had on, the wholesalers, retailers. You're telling us that this odd even policy did not really work as desired. So that's your point of view. There has been a significant amount of business impact that you've also seen in just first 20 days of the month of January. 60% of the business was lost. Let me also now go across to Dr. Soumitra Rawat, member National COVID Task Force. Sir, you've heard how, people have been suffering. Do you think with the way situation is in Delhi right now, it'll be prudent to really start considering easing the curbs?
I think, first of all, thanks a lot, Heena, for inviting me. I think we need to have a look at the numbers. And, yesterday we had 12,300, with positivity rate of 21%. So positivity rate of 20% is pretty high. And obviously, at the moment, whenever there is a variant of concern, we look into various features of the virus. So we know for sure that this virus is 3 to 6 times more infectious than Delta. Regarding the virulence, it's still emerging. At the moment, we know it's slightly milder than Delta, but things can always change. And third is the immune escape mechanism, where the vaccine we have received, whether it'll work on this particular variant or not. I think the most important thing, Heena, is a COVID appropriate behavior. I think we need to see why we land up here. You have seen the markets in November and December. There was a video going viral all over. What was the situation in the various market? I don't want to name any particular market. I think there has to be a fine balance between the economy and the health. I think we can look into in next few days, and then we can take a call. At the moment, what I feel that, you can do it slowly, but, you don't want to have a surge coming again. We have been bitten once with the Delta variant, and it was really, really bad at that time. I think the most important thing is a COVID appropriate behavior, where anybody who goes out needs to wear a mask covering the nose and mouth. And, you need to sanitize your hand again and again whenever you touch the external surface, and 2 gaj ki duri or 6 feet distance. If we are sensible and if we are doing this, economy and coronavirus can go hand in hand. We won't have a surge. There is a study that if 80% of the population is wearing a mask, the curve is flatter. And if it is less than 50% of the population wear the mask, curve is very steep. And the kind of numbers we are getting, I think we need to look for a couple of more days.
Okay, so it is not the right time to lift the curbs immediately. We need to see if this trend continues really for the next few days. Something that, in fact, even the Aam Aadmi Party spokesperson also told us that we need to be very, very cautious, because this, low hospitalization rate could also be because people were largely indoors because of these restrictions that are in place. Let's also hear from the viewers on the show tonight. We have Deepika joining us from Vadodara this evening. Deepika, good evening. What is it that you would like to say?
Ma'am, thank you for adding me to this show. I would say that nobody talks about the middle class, people who have lost the job, seniors without pension, people who have lost the rental income. We all are suffering. I agree to that. But apart from them, this is a pandemic, and we don't even know how the virus is reacting. Now we even don't know if you don't have temperatures, you may be carrying the virus. The problem which I find is that people are attending offices, and which is very scary, because somebody may be a carrier and nobody knows about it, not even him. So I think it should be mandatory that whosoever is attending office, there should be regular tests, the vaccination should be there, and even for public places, vaccination should be 100% there. And I am very confused by the term frontline warrior. Even a person who is going to a job and adding to the economy is a frontline warrior for me. And the boosting should be done, because nowadays, 30, 40 years, people have blood pressure, diabetes, a lot of other elements, which I am sure the doctor on the panel would agree with me. So the boosters, because a lot of people had it in April when it started, so the boosters are needed for them also.
You've made a couple of very, very important points. Thank you, Deepika, for calling us here on Urban Debate this evening. We have Ramchandra from Gurugram as well joining us on the broadcast. Ramchandra ji, good evening. Thank you for calling us here on Mirror Now. What is it that you would like to say or ask?
मैं यही बोलूंगा कि सरकार को सोचना चाहिए बिजनेसमैन के बारे में, मिडिल क्लास पीपल के बारे में, और जो डेली वेजेज के मजदूर है उनके बारे में। और फट से किसी के ऑफिस को बंद कर देना, किसी की दुकानों को बंद कर देना, ये इतना इजी नहीं है। और वो एक बार उनके शू में घुस के सरकार जब देखेगी, जब एक बिजनेसमैन के, तब उसको आइडिया लगेगा कि कितनी प्रॉब्लम फेस होती है। आज ऑफिसेज को बोल दिया गया बंद रखो, ऑड एंड इवेंट चालू कर दिया गया, जिसमें कि एकदम माइल्ड केसेस है, हर जगह हो रहा है, 3 दिन में 4 दिन में ठीक हो जा रहा है। तो मेरे ख्याल से एकदम भी सारे रेस्ट्रिक्शन इमीडिएट ऑल इंडिया हटाने चाहिए और लाइवलीहुड पे पूरा फोकस करना चाहिए। जिसको डर लग रहा है वो नहीं निकले घर से, वो अपने घर में बैठे, कोई पकड़ के थोड़ी ला रहा है कि आप निकलिए घर से। जिसको पोसाता है, जिसके पास पैसे हैं, जिसका बिजनेस नहीं मार पा रहा है, वो अपना घर में बैठे, और जिसके लिए रोजी रोटी जरूरी है, जिसके लिए लाइवलीहुड जरूरी है।
नहीं, आप बिल्कुल सही बात बोल रहे हैं रामचंद्र जी, हमसे बात करने के लिए बहुत शुक्रिया। Reena, will you like to address the concern, because people do get impacted if suddenly restrictions are imposed, but then it is a matter of saving lives too, so it's a very, very tricky situation. Could you unmute yourself?
Yeah. So at one end, we do hear the traders and the business people, and we understand that there are economic losses, and the whole country has been impacted, the whole world has been impacted. But at the same time, scientists and doctors are advising us that we still need to be cautious, and we cannot suddenly open. So, it has to be a very fine balance, and the government at the highest level is monitoring the situation on a daily basis. As soon as the government feels that the situation is under control, the positivity rate, we are hoping will go down up to 15%, 10% in the next week. The government will be very happy to call a meeting of DDMA and pass an order and start opening up things which are possible to open. Having
Reena,
said that,
is there a benchmark that you will be looking at before, reviewing the restrictions? Like you just mentioned, you're waiting to see if the positivity rate goes down to about 15 or 10%. So is there a level that you are going to be watching out for in terms of positivity rate or daily COVID count before you decide?
So we are being told that, if given the way this virus is behaving, this variant is behaving, if the positivity rate is somewhere between 10 to 15%, some of the restrictions can be lifted. Having said that, Heena, we also, the government of Delhi has come out with a very good home isolation package. The government is giving yoga classes to people who are at home so that, people can get well soon and get back to their livelihoods as soon as possible. So I would also urge through your channel to people to please avail all of those facilities. So as a city, as a state, we all also become healthier. Our immunity levels are up so that, in case, God forbid, there is another variant, we are better prepared for that.
Okay, we have another viewer now joining us on the broadcast. You told us that you're looking at positivity rate around 10 to 15%. That's when you'll be comfortable to lift certain restrictions. That's an encouraging number. Joe William is joining us from Pune now. Thank you for calling us here on Mirror Now. What is it that you would like to ask?
I just want to know, why do we want to have such kind of elections? We talk about, having restrictions among the common man. Okay, you don't move out, you have these 144 section. We do have elections. We just had elections in Bombay. Don't you think these are all the reasons for the increase in the curve of the virus? You might name that.
All right. Thank you very much for calling us here on Mirror Now. And we have another viewer joining us, Anil Sood from the National Capital. Good evening, Mr. Sood. Thank you for calling us. What is it that you would like to say or ask?
The government is declaring the positivity rate of about 21%. Unfortunate part is that it is not considering the people, those who are getting self-tested and are going for self-isolation. If you look at the death rate also, it is steadily increasing. What does it indicate? Does it mean that...
okay. Thank you very much, Mr. Sood. Yes? Okay, thank you very much, Mr. Sood, for joining us here on Mirror Now. Now, I will like to take this question across to the doctor on the panel. Dr. Soumitra Rawat, will you like to address this? Because today only, even though indicators like positivity rate and daily case count has been coming down, the number of fatalities because of COVID have actually gone up.
I think that is what I said, Heena. We need to take the things slowly, because we have been bitten once by such a tragic event of the second wave. So we need to be careful, because what happened that, we are saying it's mild. So, when it affects, older people with comorbidity, and mortality doesn't happen as soon as you get a virus, it takes a couple of weeks, to know. So as we know a bit more about the mortality rate, as we know more about the other things about the virus, we are having an aggressive genome sequencing for the mutation also. We need to be careful. Is there any other mutation which is coming? I think the worry part is we are thinking it's Omicron and suddenly virus changes its mutation and there is something else which comes in between. So I think we need to be careful. I am really, sad to hear about the business part that, we are losing a lot of economy. But here we need to make a fine balance between the business and the health of the country also. We can't go through the same second wave. So if we are careful about, and whenever we open the business, I think the most important thing is COVID appropriate behavior, and people who haven't taken the second dose of vaccine, they need to take it so that we are, well prepared. Other thing is the implementation. Suppose if there is a rush in one of the business place or in the market, we don't need to repeat the same mistake. I think we as a public need to follow the rules, and the business also, and the small trader in the market, they need to make sure there is a proper social distancing so that we don't have any further wave.
Right. But, Dr. Soumitra Rawat, an interesting point was also made by one of the viewers just now that, if you open the offices again, then, regular tests should be there. For example, maybe weekly test or something. Fully vaccinated people only should be allowed at public places. Do you think that is a, viable solution? Because saving economic activity, saving livelihood is equally important, as Mr. Khandelwal was mentioning earlier, as Mr. Hemant Kochhar was telling us about the hospitality sector. Can that be done?
I think that is absolutely a correct thing, that, every individual institution need to take the review of what they can do. Like I work as a surgeon in Gangaram. I am a chairman of surgical gastro in Gangaram. When the COVID started, we made so many changes in Gangaram so that, we have a window in the clinic room, and, all the air conditioning, centralized air conditioning was made to change, so that every institution need to make the changes so that you have a proper ventilation where people are sitting in the office. There is a proper social distancing, and there should be a regular checkup, and anybody who is having a mild symptom should not be allowed to come to the workplace, and there should be a regular checkup as well, and regular testing, which you have said is absolutely right.
Okay. Hemant Kochhar, what is your opinion? Do you think regular tests, even if, in businesses, specifically in hotels, the restrictions are lifted, regular tests can really happen? Do you think that's feasible?
That is important, I agree. But, the only problem is when you have to look at a test, it's only possible at the check-in time in a hotel. So anybody who's checking in, then only you come to know that whether he has the vaccination report or any reports we want to check. I would suggest that if a mobile-based small ID kind of a unit can be installed, if the government can work on that, so that everybody can show that, and it is very clear that this person has the second vaccination already done. The problem is anybody who comes to the hotel, firstly will take out that vaccination, takes a lot of time. And in that time, if the person is infected and does not have the vaccination, it is a big risk for everybody. Secondly, it is important for the hotels and the restaurants, because it's a human industry, to make sure that all the checks and balances within the industry are put in place. That is the future of this business, because every client will come to these hotels and restaurants only when they know that safety is completely taken care of and they are safe in that hotel. So that is the second thing which is very important for this industry.
Absolutely. Okay. We have another viewer now joining us on the broadcast. Matthew is joining us from Bengaluru. Good evening, Matthew. Thank you for calling us here on Mirror Now. What is it that you would like to ask or say to the guests here on the show?
Good evening, Heena. I've got a couple of points to make. First up, the priorities are not proper. See, it's all misplaced priorities, what is happening.
Okay.
Initially, when we had COVID, there was so much of concern about it because nobody knew what is going to happen. The fear of death was more than anything else. Therefore, everybody was ready to stay home, and even the nation at large was interested in finding out vaccines and things like that. The seriousness was there. Now it has come to a stage like, it's like, so what? If COVID is there, so what? We can still move on. So the attitude has just like that gone down. See, now it's something like this, in a crowded place, if a single person has a bomb with him, whether the bomb is with him or with anybody else, once the bomb blasts, everybody is going to be affected. It's exactly the same thing what's happening now with this COVID. We are taking it very lightly now. You take the politicians, they're absolutely not bothered about the after effects of what is going to happen. So now what I would like to say is that till the last person is safe, we are not safe. Till the last person in our country is safe, none of us are safe. So we have to give priority for this vaccination. As much as vaccination, we should also ensure that the entire nation, we should have a uniform policy wherein the vaccination.
So you're of the view that it's not the right time really to lift the restrictions, Mr. Matthew, if I've understood you correctly.
And not only restrictions. See, what we say is we take away restrictions. Again, after 15 days, again it comes. So what's the point of taking restrictions? What we need to do is that we have to ensure that everybody.
So we have to be very, very cautious.
Yes, and not just cautious. What I'm saying
the concern is still there. We have to be very cautious. All right, Matthew, appreciate you joining us here on Mirror Now. We have another viewer joining us, Nagesh from the National Capital. Good evening, Nagesh. Thank you for calling us here on Mirror Now. What is it that you would like to ask?
Yeah, see, my name is Nagesh Bakshi. There are a couple of things I would like to highlight. One, madam, you just now...
Yes.
Yeah, madam, see, first of all, just now you objected to Mr. Khandelwal. Don't make the issue political. Why you have a AAP spokesperson on the line? You should have called for a government spokesperson in place of Aam Aadmi Party, one thing. Second, I am down with corona. Today is the 8th day. And I am the 4th one in my family to get corona. Couple of my friends are down with corona. When I checked from everybody, what corona you have? It is a Delta or Omicron? Nobody had an answer. I talked to my lab. They said, no, you have Delta. And I checked from my friends, everybody is having Delta. Here we are saying Omicron has come in. So where Omicron reports are going then if everybody is having Delta? I talked to around 20 people down with corona. Out of them, 12 responded to me and all said, we have Delta. This is what our lab has told us. There is nothing is written on the report. It is Delta or it is Omicron. So from where this Omicron is coming then, if everybody is having Delta? Third thing, this lockdown issue. Who is going to pay for our employees for this lockdown?
That is the reason we are having this discussion today, Mr. Nagesh. I really appreciate you joining us here on Mirror Now and sharing with us your perspective. We have the Aam Aadmi Party spokesperson on the show today because it is Aam Aadmi Party governments in the national capital that we have, and we need to also understand their point of view. How soon can we expect the restrictions to get lifted? It's not a political debate. It is about the lives of people which is getting impacted, and that's the reason why the focus today evening is to understand the difficult difficulties that people are facing, that businessmen are facing, and what can be done to, solve their problems, solve their concerns. At the same time, how are we managing to save lives as well? So that was the reason. I hope you've got your answer, Mr. Nagesh, but I appreciate you calling us here on Mirror Now. We have Captain Jaspal joining us from Rohtak as well, a regular viewer for Mirror Now. Thank you, Captain Jaspal. What is it that you will like to say today?
Heena and the doctors and the spokesperson of the AAP, very good evening to you. And you are the only channel that has opened up the citizens to speak. Hats off to you. Kindly continue. The heaven is not going to fall if you become number one again. Now coming to the doctors. Doctors, first thing is I agree with you that the enemy should not be taken lightly. The biggest mistake one can make is to treat its enemy as weak and take it lightly, especially one who can multiply and mutate. Secondly, doctors, as you people know yourself and see your face in the mirror, it comes and sits on the face. Face becomes puffed up and is how to take it out of your from under the skin. And what are the other resting places of the virus under the skin? If you advise the people, they will be mighty thrilled and mighty relieved.
All right. Thank you very much, Captain Jaspal, for joining us here on Mirror Now and sharing with us your concern. Dr. Soumitra Rawat, of course, there are concerns that viewers have because many still feel that, the symptoms are not of Omicron. So it also shows that, Delta seems to be prevalent too in parts of Delhi, NCR.
Yeah, at the moment, what happens, Heena, because what happened when somebody is tested positive, then it goes to, for genome sequencing. And genome sequencing takes about a week. So by the time it's for a week, you don't know whether you got a Delta or whether you got a Omicron. Because gene sequencing take a time. And when the number increases, then there is a certain amount of test you can do for gene sequencing and it takes 7 days. So that is what I'm saying. You need to be careful. You cannot say that I have got a Omicron as soon as you are diagnosed, and you cannot say that I will have a milder symptoms only. That is the reason we need to see it for next couple of weeks, and if it is a Delta, then we know how much havoc Delta has caused us. So that is the reason we need to be careful. And even when we relax some of the stringent things we have, the most important thing is implementation. We need to make sure that the authorities are checking all the markets, all the public places, and make sure that people are wearing the mask. Whether it's alpha, beta, gamma, delta, Omicron, the most important precaution is the mask. And we have seen that in November, December, people were not wearing the mask, Heena.
Absolutely. And also, Dr. Rawat, like we've got data from Kolkata as well. And in Kolkata, the ICUs, it seems, are full. So the situation there is much different from what we are witnessing in Delhi, what it was in Mumbai. I want to give the last word now to Reena Gupta, spokesperson of the Aam Aadmi Party. You told us earlier that a positivity rate of about 10 to 15% that you're going to be looking at. But in terms of restrictions, which restrictions do you think can be safely lifted in a situation like this when you're still in a wait and watch mode? But at the same time, there are people who coming and saying that, our businesses, our livelihood is getting impacted. So maybe can you begin with some easing as far as weekend curfew is concerned?
Yes, Heena, the restrictions will be lifted in the same order as they were imposed. Also, Heena, I understand that the industry has been really negatively impacted, and one is really hoping that the central government takes a note of this and gives some incentives, some tax breaks to the industry. As you know, under the GST regime, there's very little which is under the state government. So we're really hoping that the central government, make sure that the industry is compensated in some way. As far as Delhi government and the state government is concerned, we have given out direct cash transfer to some of the people whose livelihoods have been negatively impacted, like people from the transport sector and also people, daily wage laborers. They've all been given direct cash transfer by the Delhi government. Also, Heena, the doctors pointed out today how important genome sequencing is. But today only I was reading that 5 of the central government's labs, which do the genome sequencing, are being shut down because of lack of some chemical reagent and lack of funds. So, in a time like this, in a crisis like this, we cannot afford to have any of these labs shut down. And I'm hoping that the central government takes notice of this and make sure that we continue to do the sequencing. Because the one thing that we've seen is this virus just keeps mutating and keeps changing its course and behavior. So, Heena, let's just all hope together we'll be able to overcome this. The Delhi government is being very proactive, watching the condition very, very closely. And as soon as the scientists and the doctors tell us that it's okay to lift restrictions, we'll be the first ones to lift restrictions because, the industry is negatively impacted. At the same time, the revenue collections of the governments are also negatively impacted. So we do want to open it up as soon as possible.
Well, absolutely. All right. So the sense that we've got is that probably it's not the right time to immediately lift all the restrictions. We'll have to see whether this trend continues, the trend of cases coming down, positivity rate coming down, continues for the next few days as well. I appreciate all of you for joining us here on Urban Debate on Mirror Now this evening. We have to slip into a very, very short break, but there's lots lined up for you on the other side as well. Karnataka is seeing an unprecedented spike in cases. We'll tell you on the other side. Stay with us.